Hi there, it's Dr. Laylee Javon coming to you from the office. And today we're going to be talking about breast augmentation because that's a very common consultation that we see. And this kind of ties into our last Instagram Live about mommy makeover. So, a portion of the mommy makeover being some procedure done to the breast. Mostly when patients come in to talk to me about breast augmentation, they've usually had a friend or a relative who's had it done before, and they oftentimes have some kind of idea about size that they're looking to go to. Now, one of the important things is that I do need to examine them because oftentimes what happens is that patients may think that they only need a breast augmentation, but the reality is they need a lift as well. A lift being a procedure to rearrange the breast tissue up higher so things look restored and in proportion to the usual or previous state. Oftentimes patients who have breastfed in the past end up needing some kind of lift, but that's something that I can help you determine as soon as I do your exam and take a look. So when patients come in, they do have some ideas about how large they want to go. However, I'm there to try to help them make a good decision and guide them in their decision making. Oftentimes they'll bring me pictures of something that they'd like to look like, or a description of what size implant somebody else has had. But we have some really fantastic ways to help patients. One of them is that we have a patient bring a sports bra in and try on the implant with the snug fitting sports bra. I find this to be really helpful and very accurate. Another way is that we have what's called a Vectra, and that's a 3D imaging machine so that the computer takes a picture of the patient and then it allows us to put implants in of varying sizes and reconstructs the new form up on the computer screen. Patients absolutely love this because it really seems to take away the mystery out of trying to decide what size looks good on what body type. And usually when patients come in, we have at least 2 consultations, but my goal is to try to make patients feel as comfortable as possible with their decisions so that by the time we get to surgery, they are excited and completely ready to roll into surgery. Beforehand, we are all about safety here, so we like to get blood work, and if age appropriate, we get mammograms. Also, we get a clearance physical from their doctor. And then sometimes patients ask me what they can do ahead of time to get ready for their procedures so that they can be better prepared or do better during their surgery. Honestly, there's a couple things. One is to really respect the time off and recovery time needed, so that you're not feeling like you need to go hop in the car and run to the grocery store, or that all of a sudden this is the time to be moving furniture or rearranging furniture or doing housework. This is a time to recover because patients who respect their recovery time tend to do better, tend to have better results and fewer complications. So what does that recovery time look like? So what I usually tell patients is that if you have a desk job where you work 9 to 5 and you have to drive to it as a reference point, that you're going to need about a week off where you're at home. Now, it doesn't mean if you are able to work from home that you can't work from home, but you do need some time to rest. And certainly the first couple days you may be taking some pain pills, so you don't want to be under pressure to perform at work if you need those pain pills. Usually patients are ready to be able to drive after about a week. Another question is, when will I be able to exercise? When can I get back to physical fitness? Now, I feel the key to patient success is to walk and move from the get-go, from first day. However, as far as exercise goes, where you're actually increasing your heart rate and blood pressure and working up a sweat, I usually say with the lower body at 3 weeks and with the upper body at 6 weeks. But even when you're, quickly walking or exercise walking at 3 weeks, I like patients to wear a very good supportive bra or even 2 bras just to really support the area. And then as far as being prepared for your post-op time, I also tell patients try to make sure that you have all your grocery shopping and done so that you feel like you've got everything you need and nobody needs to take trips to the store. Make sure that kids are taken care of as far as their rides to school, as far as any practices and all that kind of stuff. Maybe you've got a friend or a relative that can help you. And those are the main things as far as preparing ahead of time. And then I like to tell patients as well to have some ice packs made up already because interestingly enough, patients find that just using those ice packs really helps with the discomfort and pain control afterward. So make sure you have those at home. And then another great question that patients ask me all the time is, when will I see my final results? So some patients get super lucky and pretty much look the way they're going to look from day one, which is fantastic, with maybe just a little bit of minor swelling. But I generally tell patients that it could be as long as 6 months before they have their final result. Due to swelling mostly. There usually isn't much in the way of bruising for this kind of procedure, but the swelling sometimes can cause the implants to sit higher on the chest wall until that swelling goes away for quite some time. So we usually tell patients that they need to be patient and wait 6 months till they see their final results. But like I said, some people get very fortunate and the implants drop right into place right away. Then another great question patients ask me is when they can go bra shopping. We recommend in our office that you purchase a special surgical bra, that we give you instructions where you can purchase it and instructions on sizing. And then really, I wouldn't spend much in the way of I wouldn't spend too much money on an expensive bra for, again, at least a good 6 months. If you want to switch to something besides a surgical bra, it just should be something without an underwire, not a sports bra, but something that's just not very expensive. And I think that's pretty much it. Another great question is, what about the post-op visits? What do those look like? So once you've had surgery, that's really just the start. We see each other frequently after that because I like to keep a close eye on my patients and be there both emotionally and any other way possible for them to go through their journey post-operatively. We see each other the very next day, and patients, when they come in, we take the dressings down, we take a look and put the bra back on them and send them on their way. Next visit is at about a week, and then after that at about 3 to 4 weeks, and after that at about 6 weeks, and so on for the period of 6 months to a year. Now, sometimes we see patients even more frequently than that, but that's kind of typical. And the important thing is that I like to make sure that my patients feel very connected and feel if they have something come up over the weekend or in an evening that's distressing to them and they're just not sure if that's normal, that they can reach out and talk with me or call me. And to that end, I make sure that I provide them with my cell phone number so that they can reach out to me very easily, because I would much rather see them have their question answered and it only takes 5 minutes of my time, rather than have them stress out and worry and I don't know, go to the internet for answers, because I'm absolutely available to help. So I think that's a pretty good start. Another question that patients ask me is about type of implant. So implants, there's a wide variety of implants out there, but they break down into silicone versus saline. The majority of patients come looking for silicone implants. They're both very nice implants. The silicone feel a little more natural, like natural breast tissue, and tend to ripple or wrinkle less. The saline do tend to ripple or wrinkle a little bit more, and they are a little firmer, but they also make for very nice implants and a very nice augmentation in the right patient. But that's the kind of thing that we tend to go over thoroughly in the office when we're making decisions about size and type of implant. Usually we bring them out so patients can feel them and take a look and make a decision. So if you have any further questions, I would love to entertain them. Just give me a call, or you can message me on Facebook or Instagram. Please, if you don't mind, follow us on Facebook and Instagram to keep up with what we're doing in the office, and I look forward to seeing you soon.